What if I told you that not all Medicare is the same? It is one of the most discussed topics in the healthcare industry, but when you get into the details, it's a little bit more complex. So what are the different parts of Medicare? And what is the difference between, say, supplemental plans and Medicare Advantage? A lot of different questions when it comes to Medicare, and Kristine Grow joins us tonight to break down those questions and more. That's all coming up right here, right now. I'm Sam Chen, and this is Face the Issues. Good evening and welcome to Face the Issues. I'm Sam Chen. Medicare is one of the most talked about issues in the healthcare industry, and for good reason. The vast majority of senior citizens are on it. But when you get to the details of Medicare, the plans are not quite the same. And there are differences between the parts, between things called Medigap and Medicare Advantage, and the details can get a little bit hazy. We're joined tonight by Kristine Grow, who's the spokesperson for the Coalition for Medicare Choices, and she joins us to talk about all these different parts of Medicare. Kristine, welcome to Face the Issues, and thank you for joining us.
Thank you so much for having me.
It's so good to have you here. And this is, again, it is something because so many seniors are on it. The majority of our seniors use Medicare in some way, shape, or form. And yet it is more complicated than just saying you have Medicare. And so I just want to ask you, from the very beginning, the basics, what is Medicare and who qualifies for it?
Sure. So Medicare is a form of health care coverage that millions of Americans, in fact, tens of millions of Americans nationwide have access to. If you are age 65 or older, if you are a younger person with certain disabilities, or if you are someone who is struggling with ESRD, end-stage renal failure, which is a form of kidney disease that requires dialysis, you qualify for Medicare. There are a lot of different kinds of Medicare plans that are available, and I'm happy to talk with you a little bit more about those choices that people have.
Yeah, let's talk about some of those. I think before we do, though, I think there's some confusion occasionally when we hear Medicare and Medicaid. And obviously, at the federal government level, it's called the Center for Medicare and Medicaid Services. Is there a difference? And if so, what is that difference?
There's a very important difference between the two programs. The Medicare program is run by the federal government at the federal level, and that's available for all Americans. And as I mentioned, it's primarily for those who are 65 or older if you have certain disabilities. The Medicaid program is a partnership between the federal government and the states, and it is a form of coverage that's available for people and families who are lower income and have fewer resources, that provides them with that additional support so that they can continue to get the health care they need and deserve. I will say there's a very important to note that people can qualify for both Medicare and Medicaid. Those are people who are often called dual eligibles because they're eligible for both programs, so they may have both forms of coverage available to them.
Well, thank you for that clarification. And then to your point earlier, Kristine, you said there's multiple pieces of Medicare. And traditionally, we hear of Medicare in terms of the parts. We hear Part A, Part B, Part C, Part D. What are those different parts?
Yes, there's a lot of letters, but I don't think we should allow that to confuse us. So I'll try to break it down pretty simply. Medicare Part A is the part of Medicare that covers inpatient services. So those would be things like hospitalization, nursing care facilities, hospice care, or inpatient care that may even be delivered at home. Part B is what you would normally think of as your primary care doctor visit or other care provider, outpatient services, some home health services, durable medical equipment. That all falls under Part B. Part C is what we also call Medicare Advantage. Medicare Advantage bundles together Part A and B, and it also often provides a whole lot more services than A and B provide. Things like dental health care coverage, vision care, hearing care. It will also even include some drug coverage for your prescription drugs. So there's a lot that's available for Part C. Part D is your prescription drugs. And then after Part D, there are a lot of other letters of the alphabet, which are different kinds of Medicare supplement plans, which are also often called Medigap plans. Those kind of bolster onto your original Medicare plans to provide you with additional coverage and choices.
Understood. And so you mentioned Medicare Part C, Medicare Advantage. Much of the work that you do is in the world of Medicare Advantage. Would it be correct then to say that if you have Medicare Advantage, you don't also enroll in A and B? Is it an either or, you have A and B, or you do Medicare Part C?
That's a very important distinction. So in order to enroll in Medicare Advantage, you must enroll in both Part A and B. And then for a lot of Americans, they can bundle these together under Part C for little to maybe no additional premium. So you can get additional coverage, additional benefits, additional services without any additional premium cost to you. So it can provide better value, it can save you a lot more money, and you can get a lot more for your money that way.
So the requirements are the same, right? If you don't qualify for, let's say you're a healthy 40-year-old and you don't qualify for A and B, you can't just walk in and say, well, then give me Part C. The requirements are the same.
That is correct. Yes.
Okay, that's a good clarification to make. And so some of the other terminology, you mentioned these a little bit. You said there's like alphabet soup with Medicare. And some of the terminology we heard, we talked about Advantage. We also hear Medicare Supplement or Medigap. What do those terms mean?
Medicare Supplement and Medigap are the same thing, and they are just additional options that people can have. They can provide different additional layers of benefits, additional layers of coverage. Often these kinds of plans may be comfortable for people who may travel a lot and be in different parts of the country to get their coverage. It really is all depending on what your personal need is and what your choices are, which is really a hallmark of the American healthcare system, is people like to have personal control, personal choice about what their coverage is, choose coverage that is specifically right for them. So having original Medicare, Medicare Advantage, Medicare supplemental plans, or Medigap available to you, it really allows you to tailor your coverage to what you're looking for.
The supplemental plans, the Medigap plans, those are not run by Medicare, correct? These are plans that are run by private insurance companies?
That's correct. So when you're looking at Medicare supplement plans, when you're looking at Medicare Advantage, and when you're looking at Medicare Part D, all of those are available through the private market. These are the health insurance providers that you may be very familiar with and comfortable with through your job, through the individual market. A lot of the brand name companies that you think of who provide healthcare coverage, those are the ones who are providing that coverage. Now, one thing that I think is important to mention is it is also a good public-private partnership. So the agency that you mentioned, the Centers for Medicare and Medicare Services, CMS, they provide a lot of administration and oversight and guidance about what these plans should look like. There is what's called a bidding process, so that plans are challenged to compete with one another every single year to offer the lowest cost possible with the highest value benefits. And by doing that, you make your product more competitive, more people choose you. So it's really the competitive market at work along with the federal government to provide this very high quality healthcare that today 29 million Americans are choosing. And in the state of Pennsylvania alone, about 1.3 million people choose Medicare Advantage today.
Wow. Those are good numbers. Kristine, let me ask you this. We talked about Medicare Advantage, Medigap. You talked about a lot of this additional coverage. That would imply that Medicare itself, the original Parts A and Part B, don't cover everything. I think there's a misconception, right, that they cover everything or that it's free. But there is a premium, at least for Part B. Could you talk a little bit about what you're paying in Medicare, traditional Medicare, and what is it not covering?
I think a lot of folks are not aware that when they qualify for original Medicare and they choose Medicare, that you do have these premium costs that you have to pay. You also have out-of-pocket costs. So you may have to pay, say 20% of a medical bill that you might get. So the Medicare Advantage plans really provide you with a lot more coverage and can do a lot more to protect your financial stability and what you invest in healthcare. It also just provides a lot of additional peace of mind. Because it is a public-private partnership,
Mhm.
there's a lot that these plans can do to help the people that have these plans. We especially saw that during the COVID-19 pandemic as more supplemental services were added by these plans to provide, say, transportation back and forth to the doctor, or the ability to see your doctor through telemedicine or telehealth services. They will often have some additional programs to connect you with healthy foods, especially as that is unfortunately a problem that remains for a lot of people in underserved communities. So there's a lot that these plans do to lean in to get people healthier faster and keep them healthier longer.
Is this why we see so many people on Medicare that carry two cards? There's a Medicare card and then there's that second card. Is this what the second card is for?
That's right. So you may have a card that has, say, your health insurance provider that provides that kind of coverage. And it's just a lot more flexibility and a lot more value. There are surveys that are done every single year about how seniors feel about their Medicare Advantage, which is what my group represents, the Coalition for Medicare Choices. And an overwhelming majority of seniors who have Medicare Advantage say they like it and they would recommend it to their family and friends. Say 93%, 95% are some of the figures that we're seeing. And to see that kind of wide-ranging agreement on something is pretty remarkable, especially when we see so many disagreements in other parts of the American society these days.
I mean, even just in healthcare, there's so many different disagreements all the time. And so, Kristine, I really appreciate you breaking down Medicare. We're going to go to break, but when we come back, I want to ask you specifically more about Medicare Advantage, some of the differences between that and the traditional Medicare route, and then also how you would advise senior citizens look into these plans. So don't go away. We'll be right back.
Face the Issues is produced and recorded in the studios of Lighthouse TV. Positively different.
Welcome back to Face the Issues. Again, my guest is Kristine Grow. She is the spokesperson for the Coalition for Medicare Choices. Kristine, we talked about Medicare. I want to thank you again for breaking that down. All the alphabet soup sometimes makes it confusing. And so it's nice to just kind of have it laid out for what parts are what. And that makes, I know, the application process and the enrollment process easier. I want to talk about Medicare Advantage, and that is the bulk of the work that you and your company do, your organization do. With Medicare Advantage, we talked earlier that this is a private-public partnership. Could you expand on that a little bit? And what does Medicare Advantage do that, say, traditional Medicare Parts A and B do not do?
Sure, happy to. So as I mentioned, the federal government, specifically this agency, CMS, are responsible for administrating the program. So they review the plans regularly for quality, for the value that they provide, for the competitive nature of their bids, to ensure they're covering not just what original Medicare covers, but also so much more. And the health insurance providers that provide the plans work very closely with the federal agency to offer recommendations about how the program can be improved year over year over year. And what we see is those Medicare Advantage plans, as a result, have really stellar clinical measures that they achieve, really high satisfaction rates from the seniors who have these plans, and just continued value and more money for the healthcare dollar that you invest. Year over year, these plans continue to offer better care and better services for a better value for the American people.
There are some people who will do the Medicare Part A, Part B route. They will perhaps add a Medigap plan and then the supplemental plan. How does that, what are the key differences then between doing it that way versus doing Medicare Advantage, where it's all, if I understand correctly, it's all grouped together as one?
It can be a lot easier for someone to manage and have a Medicare Advantage program. It's also what we continue to hear is there's so much more that you get with that plan. Again, original Medicare does not cover dental care, vision care, hearing services, prescription drugs. These Medicare Advantage programs can often bundle all of these together so that you have all the coverage for these services. One of the other things that we hear frequently from the seniors that have these plans is there are a lot more benefits that they like that they get. We continue to see seniors prioritize their health and want to stay as fit and healthy as possible. So we have a lot of fitness programs that may be available through Medicare Advantage plans that allow them to take advantage of the Silver Sneakers program or go to their gym or take advantage of their health. And these are really important because when people are healthier longer, everybody wins.
Can you expand on that a little bit? The idea of preventative care, and we all hear all the time that the bulk of someone's medical spending occurs toward the end of their life. And when you think about it, it makes sense. As we get older, unfortunately, we just develop more medical problems. We're less fit, we're less in shape. Even professional athletes will say that the older they get, the harder it is that for them to stay at that level. So could you expand a little bit on the preventative care side of it, and what are some of these different options that Medicare Advantage offers, and why you push your members to take part in preventative care?
Preventative care is so important, and there's a lot of different kinds of care that fit into that. One of them is your annual screenings with your primary care doctor to see how's your blood pressure doing, how's your blood sugar doing, so that you can identify issues early and address them early, perhaps before you need a major intervention like a surgery or a prescription drug that you might have to be on for a very long time, if not for your entire life. Identifying these issues early just allows you to feel better faster and choose a pathway that may involve, say, exercise or a change in your diet. There are other things that fit into that, such as vaccinations, and we certainly saw through COVID-19 and the flu season that vaccination is extremely important. And the Medicare Advantage plans are very invested and very much support vaccinations for the diseases that people and the viruses that people can get. So that's an important part of it as well. Fitness programs, and not just for physical fitness, but for mental fitness and mental wellness is very important as well. So you may have access to mental health services or apps or other sorts of technology that allow you to maintain your best mental health in addition to your physical health.
Kristine, one of the things you had mentioned earlier too was some of these additional benefits like dental, vision, hearing, and when we think about in our world where our employer covers our health insurance or we get off the marketplace, oftentimes there are additional plans for this. So you have your healthcare plan, and then you have a dental plan separate, a vision plan separate. Are these then not included in, say, Medicare Part B? Would that be like traditionally with our employers, where this is extra coverage you can pay for? You mentioned it's included with Advantage. I'm assuming if you are not in a plan like that and you need to go to a dentist, you're paying that out of pocket then?
That is correct. So original Medicare does not cover those plans. So there's services such as dental, vision, hearing. The good news is about 98% of the Medicare Advantage plans that people can choose do cover those services. And often they will cover them for no additional premium for you. So that can be a huge value that people can get today.
Kristine, let me ask you two big differences when you talk to people in the financial world, financial advisors, so on, they'll say there's two big differences between Medicare Advantage and Medigap, cost and network. Advantage plans, to your point, tend to be lower premiums than, say, using your traditional Medicare route plus the supplemental plan. The premiums month by month tend to be less, but they say the downside of it is that there may be more out-of-pocket expenses depending on what your healthcare needs are and what your travel and your lifestyle is like. On the other hand, Advantage plans have doctor networks, as do most private insurances, and not all doctors, especially if you're leaving the state a lot, will be in that network. And how do you, if you're sitting down with a senior citizen who's asking about what route they should take, how do you go ahead and balance that?
I think those are some very important questions. And the first piece of advice I would give someone is really think about what you need from your healthcare coverage. For example, as you said, do you travel a lot? Do you have a need to have a lot of doctors available? Think about the doctors that you like and that you prefer and make a list of those doctors. Also make a list of the prescription medications that you take regularly, as well as other kinds of care that you may get or that you may like to get. And we talked about some of those examples: dental, hearing, vision. If you have, say, an orthopedic specialist or some fitness programs that you're looking to engage in, if mental health is important to you, just make a full list of all of these healthcare priorities that are important to you, and make sure that the coverage that you have considers all of those different pieces. There are a few different ways that you can look at the different choices that are available to you. One of the most popular is a website that the federal government makes available. It can be found at medicare.gov, and you can compare a lot of the plans, the doctors that are in the networks, the prescription drugs that they may cover, to find what best fits you. In your area, you likely have health insurance brokers who can go through the various options with you and help you make a good choice for yourself. You can also, if you do have coverage through an employer that you really like and you want to stay with that form of coverage, you can always call up your existing health insurance provider and talk to them about the fact that you're about to qualify for Medicare. You're thinking about your choices and what they may be, and you're interested in hearing from them what sorts of products or services they may have available.
That's just great advice, I think, for anyone who's coming to that age where they want to go on Medicare. And just how to prepare themselves to get the best coverage that they can get. And so, Kristine, I really appreciate you breaking that down. I want to close the segment with the million-dollar question. I think everyone's always concerned about, will Medicare stay around? Will Medicare Advantage plans stay around? What is Congress going to do? From where you sit, from what you've seen, what does the future of Medicare and Medicare Advantage plans look like?
Well, I think the one thing that's very important to know is that Congress does recognize that seniors and people with disabilities really appreciate and rely on Medicare and the Medicare program. And a growing number of them really like and prefer Medicare Advantage. Today, we have nearly 29 million Americans who are eligible for Medicare who choose Medicare Advantage. That number continues to grow year over year. And what our coalition does is they go to Washington every year to let members of Congress know they like their program, they like Medicare Advantage, it should be protected. And it's one of those rare areas where we have very strong bipartisan support, where on both sides of the aisle, whether in the House or in the Senate, members of Congress recognize Medicare Advantage is very important for the American people.
I think the challenge, of course, is when there's that much bipartisan support, no one wants to talk about it. It's not dramatic enough for most of my colleagues in the media. And so, Kristine, I appreciate you coming on and talking about it, and I appreciate the work that you guys do day in and day out. And thank you so much for breaking down what's a very complicated, more complicated thing than people realize topic. And so I really appreciate you taking the time to do that.
Thank you so much for having me.
Don't go away. We'll be right back. Welcome back to Face the Issues. Kristine, thank you again so much for joining us. And I know now, we close every segment, or every show, talking to our guests. I really just want to get to know them better. You're not defined by the work that you do, and so we always want to just kind of meet our guests and introduce them as the people that they are. And I understand you're in the DMV area, the DC, Maryland, Virginia area right now, but that's not where you're from originally, is it?
No, I'm actually originally from Philadelphia. I spent most of my life there and still have a very warm spot in my heart for the Philadelphia and surrounding area.
Yeah, that's obviously where we are. It's our viewer base here. I've got to ask, now that Wawa is in DC, is this a frequent stop for you? Is there a Wawa craze going on in that DC area?
There absolutely is, and it's really funny when I run into other people who are originally from Philly. We will often talk about the Wawa spottings. Where is the latest Wawa popping up? Where can we get our sandwiches? And we will actually go pretty far out of our way here to go to one.
Yeah, well, we had a few shows ago, we had someone that was from the Philly area but lived in Minnesota, and it's not quite as easy to get to a Wawa from Minnesota. But Kristine, let me ask you this: this has been your career in communications and in healthcare communications specifically. What do you say to someone who maybe is in high school and college watching this, and they want to do what you do, and they're inspired by someone, maybe especially if it's a young woman who sees your example and is just inspired that you've made it to the top of this profession and you're doing what you're doing? What advice do you give them about how they can do the same and follow your footsteps?
Oh, well, you're very kind. Thank you so much for that. I would say, being continually curious about the people around you and about the industries in the world around you. When I was in school, I was always interested in the stories that other people had to tell. And then beginning my own professional life, I was interested in helping them tell their stories. So looking at it from that perspective, it's all about, what is of interest to you? How can you use that storytelling to improve the experience that people have on a day-to-day basis? And be confident in yourself, and be kind and considerate of other people around you. And that has always served me very well in my career, and as well as personally.
I think that's great advice, and I just appreciate that you think, your response was really about something that we can handle now, and no matter what field we're in. That level of curiosity, and it's not necessarily you need this degree or that internship, but always stay curious. Kristine, last question for you. When you were young and growing up in Philadelphia, did you ever dream that this would be your future one day?
I had no idea. I didn't even know these careers existed, to be perfectly honest. So it was really when I was graduating from college and looking around at what was available to an English major like me, these were some new opportunities to tell stories and to think about information and making information clear to people in a new way that I never thought about before, and is really valuable to a lot of people on a day-to-day basis.
Well, Kristine, thank you for doing what you're doing, and thank you for joining us and helping us understand and communicate these ideas as well.
Thank you.
That is our show for tonight. I want to thank Kristine Grow again for joining us. I want to thank you for tuning in as well. We hope you'll join us again right back here next week. Until then, my name is Sam Chen. On behalf of all of us here at Face the Issues, thank you and good night.